All right, thank you so much. So my name is Hillary Matlock, and I'm a policy director at Idaho Voices for Children. This event is hosted by Idaho Solutions. So we have a very important primary election coming up on May 19th, when many of our leaders are going to be chosen to serve in the state legislature for the next 2 years. And tonight is a chance to be here together to learn about important healthcare issues that are being debated, to learn where candidates are running for office and where they stand on these issues. And the goal of tonight's event is to leave each of you with enough information that you feel comfortable making informed decisions at the polls on May 19th. There are many big healthcare decisions that have been debated in our legislature over the last few months. And before introducing our panelists and beginning our discussion, I want to talk about three of some pretty big issues. And the first is Medicaid expansion. Idaho voters passed Medicaid expansion through a popular ballot initiative in 2018 with 61% of the vote. 35 out of 44 counties voted yes for Medicaid expansion. And before that, thousands of Idahoans were uninsured and fell into a health coverage gap. They didn't have health insurance through their employer, and they earned too much to qualify for traditional Medicaid, and also too little to qualify for tax credits that made health coverage affordable. Now, it's important to remember that Medicaid expansion didn't happen in Idaho because elected officials actually wanted it. It happened because thousands of volunteers and voters got involved at the grassroots level and made it happen. And this was after years of inaction by the Idaho legislature. The traditional Medicaid program covers very specific groups, including low-income children, pregnant women, seniors, and people with disabilities. And a fun fact, we cover children at the lowest income eligibility level out of any state in the country. Don't know if that's such a fun fact, but it is a fact. But the program did not help many of the low-income working adults in our state. The expansion of Medicaid gave Idaho a way to cover adults under 65 who make up 138% of the federal poverty line. For a single parent with one child, for example, it's about $29,000 a year. Currently, the program provides access to health care for about 90,000 Idahoans. In the Twin Falls area, it's about 5,800 residents. Ever since Medicaid expansion was voted in, there have been proposals every year to eliminate Medicaid expansion. These proposals did not receive enough support in the legislature to move forward, but there are several legislators who do support repeal of Medicaid expansion, and given history, it is very likely to come back again next year. Another big issue that was debated is overall cuts to Medicaid. In the past year, lawmakers have cut Medicaid funding, services, and payments to healthcare providers. In the fall, the state made pretty deep cuts, including cuts that resulted in services for mental illness that actually resulted in some people passing away. During the legislative session, we saw mental health services restored, despite some legislator opposition. And the legislature left with about $239 million unspent while cutting Medicaid by another $45 million. It was a choice by the legislature that could have been avoided. And in the end, it's our Idaho families and providers and communities that are going to feel the impact of that. And the last issue I'll mention before introducing our panelists is a new $930 million federal grant for rural health care. So last year, the U.S. Congress passed $1 trillion in cuts to Medicaid, and they attempted to soften the blow with a $50 billion grant for rural health care. Idaho was awarded about $935 million over the next 5 years. During the 2026 session, the Idaho legislature passed Senate Bill 1453 to authorize the use of these funds. However, many legislators in both House and Senate voted to reject the use of these funds. Today, we have three panelists who are very well qualified to speak about the impacts of the decisions here in our region. On our panel today, we have Jim Jones, who grew up on a family farm in Eden. He graduated from University of Oregon in 1964 and received his law degree from Northwestern University in 1967. He served as an artillery officer in the U.S. Army, including a 13-month tour in Vietnam. Jim served as legislative assistant to former U.S. Senator Len Jordan for 3 years in the early 1970s. He practiced law in Jerome from 1973 until he was elected as Idaho Attorney General in 1982. Jim served as Attorney General for 8 years. He practiced law in Boise from 1991 until being elected to the Idaho Supreme Court in 2004. He served on the court for 12 years. In recent years, Jim has worked to restore civility and common sense in the political arena. Steve Coates is the one on the far right over there, going a little out of order, is a family medicine physician with over 2 decades of experience. Stephen serves on the Idaho Medical Association Board of Trustees and is its current president-elect. He is also a medical director at St. Luke's, where he collaborates with primary care providers to improve quality care. He earned his medical degree from Loma Linda University, where he was inducted into the Alpha Omega Alpha Honor Medical Society. Originally from Twin Falls, Dr. Coates values serving his close-knit community, and in his free time, he enjoys mountain biking, backpacking, fly fishing, and supporting his daughter's activities. Aaron Houston, he's the one in the middle, is the Chief Executive Officer of Family Health Services, a community health provider with clinics throughout southern Idaho, offering medical, dental, behavioral health, and pharmacy service to patients regardless of insurance or income status. As CEO, Aaron has focused on strengthening integrated care services, supporting clinical teams, and advancing innovative solutions to meet the needs of 9 communities Family Health Services supports. He is passionate about addressing healthcare disparities and ensuring that all patients receive comprehensive, patient-centered care. So I think we can all agree they know a lot about what's going on in Idaho. Before we get started, I do have a few housekeeping rules, and I just want to address some of those and some of the ground rules that we do have for tonight. We're going to start tonight with some brief introductions from our speakers, followed by 3 questions from me, before we open up to questions from all of you. We'll end by giving elected officials and candidates a chance to tell us where they stand on issues around Medicaid, expansion, and other important healthcare issues. We welcome discourse as long as it is civil, and that means if you have an objection to something someone is saying, we're just asking you wait at least until the Q&A portion of the program to speak up. And in order to keep things on track, we're going to keep questions and comments to under 2 minutes so we can allow everybody who wants to talk a chance to speak. You can expect me to see me hold up my hand to let you know you have about 5 seconds left to make your point, where we'll turn it over to the panel to respond. All right, with all of that opening, I've made you wait long enough to actually hear from these experts. I'm going to invite the panelists to give some opening remarks, which will be limited to about 3-5 minutes at most each. And Stephen, I'm going to have you kick us off.
Thank you. Can you hear me all right? Okay, great. Just a couple of things. I think my role up here is really to try and just paint the picture of what it's like working directly with many patients who have Medicaid insurance, maybe paint the face of Medicaid. For those who didn't know already, half of Medicaid are children. So the face of Medicaid is the face of a child. The other thing that you might not already know is that more than 60%, I'll say roughly 2/3 of people who are in our nursing homes, they're on Medicaid. The reason they're on Medicaid is that they've moved into a nursing home and they have spent everything. They are penniless, they are destitute. When they have nothing left, Medicaid will kick in and help cover the costs of their assisted living, their nursing home, so that they don't get kicked out. That's what the face of Medicaid is. Now, if you'll bear with me, I will keep it under 5 minutes and stop me if I hit 5 minutes, but I do want to give you a couple of examples. And these are real people in our community, just to kind of give you a sense of what the face of Medicaid really does look like. The first one, I purposely am keeping this very generic. This person doesn't want to be able to be identified. Middle-aged man, went to college, got a professional degree, and has a serious mental health condition, needs to take medication to stay healthy. Unfortunately, he had a divorce. When he went through his divorce, his mental health condition got much worse. He stopped his medicines, and everything fell apart. He lost his job. He lost his insurance, because that's how he had his insurance. He had no money, lost his home. stopped taking his medicines because he couldn't afford them, lost his car, ends up in the ER with a mental health crisis. Now, we're lucky enough to have a psychiatric hospital in town. He ends up in the hospital. The hospital helps him sign up for Medicaid. He gets on medicine. He gets his feet back under him. Now, he was a highly paid professional. He lost everything. On Medicaid, he was on Medicaid for a year or two. He got his feet back under him. He had lost all of his family relationships. He reconnected with his family. He now has a home again. He has a job again. And he has his own insurance. So he was on Medicaid for a little more than a year, told 1 to 2 years. And that was a lifesaver for him. Probably literally, not figuratively. And for the physicians in the room, if there's some physicians, I see one at least, this is a familiar story. For our patients with serious mental health conditions like bipolar or schizophrenia or severe major depressive disorder, this is a story that we see a lot. Now, we referenced the cuts to Medicaid, so I couldn't help myself. I had to just describe a real quick patient, not a patient of mine. This is a young lady, 10 years old, lives in the community. She has a congenital brain disorder, and the family is okay with me sharing this, so that's why I'm going to share it. Her disorder is called polymicrogyria, and poly means many, micro means small, gyria is the folds of the brain, so lacking the folds of the brain that she should have. She can't stand, can't sit, can't speak. She's very, very happy. She has a happy demeanor. She loves to laugh, loves people, loves interacting with people. Unfortunately, this condition gives her seizures. She's 100% dependent on those around her. No bowel or bladder control. She can't feed herself, so she receives food and water through a feeding tube. She needs full-time care. This includes physical therapy, occupational therapy, speech therapy. She's been hospitalized multiple times with pneumonias, seizures, feeding tube complications. Her parents need assistance to lift her, especially now that she's getting larger. So they need equipment called a Hoyer lift to move her. Of course, she needs a full-time caregiver. That's her mom, and her dad works full-time as a trucker. The family went to great lengths to communicate how much joy she brings to everyone around her. You can't help but be happy when you're around this young lady. Mom was paid as a full-time caregiver, and that's actually why I brought this up today, this case. Her mom no longer makes any income, and she can't work, literally. Her full-time job, 24/7, is her child. She used to have physical therapy, occupational therapy, and speech therapy weekly. It's now every other week due to Medicaid cuts. Some of the things that they've had to do, and this is not covered by Medicaid, they need a wheelchair accessible van to be able to take her places. They built a walk-in shower. Medicaid did help with a shower chair. They've had to put in hardwood floors. She does need a new wheelchair that holds her body up so that she can move her feet and walk around. And that's $6,000 to $10,000, not 100% covered, and they need a new one of those every few years. Recently, both parents had injuries back to back, and they couldn't bathe her. They needed help with that. Medicaid did help bring in someone twice a week for a few weeks to help with bathing. Thanks to all of this therapy this girl has received, she plays with toys. She reaches and touches things. She has this special walker, so she can now go to the places in her house that she wants to go. And she's working with therapy on a special type of iPad where now she can start to communicate, where she could point at something and say, I want a toy, I'm hungry. And there is no way that this young lady would have this quality of life without this life-saving coverage that she has with Medicaid. And I think with that, I'll call it good. Thank you.
Yeah, so I'm Aaron Houston, CEO of Family Health Services. I'm going to go way over 5 minutes. So,
I'll keep you honest.
So I've been with Family Health Services for 20 years this month, and so this last few years has been the first time we've really been concerned about closures of clinics that we run. We have some pretty amazing folks that work for us, and tonight I'd just like to talk about 2 of our clinics You may or may not know about these. Family Health Services doesn't do a lot of advertising, but over in Jerome, we have a specialty dental clinic that only sees adults with special needs. That's all they see. That is not a money-making business right there, let me tell you. Dr. Fukuoka, our dentist, has a passion to treat people, adults who have disabilities. There just aren't that many dentists out there that is their passion. And so we had the opportunity to work with her to build a clinic specifically for that. And it doesn't see a lot of patients because it's a lot slower, but those patients get taken care of, and they're almost 100% on Medicaid because of the disability, and they get a lot of compassion, a lot of love with their dental care, which is kind of a weird thing, right? To be like, oh, I'm going to the dentist because they treat me amazingly, and that's what they do. The other clinic that we have, kind of unique, is in Fairfield. Well, Fairfield, Idaho, that's about as rural as you get. It's a dirt road out to our clinic, and we have medical, dental, behavioral health, and pharmacy all on site. And that means we have, the providers drive from Twin Falls. The dentist has been going there so long, he actually built his house in Gooding because he does 2 days in Twin and 2 days in Fairfield. And the nurses travel up, the dental assistants, the hygienist, the counselor, they all come from Twin Falls and go to that clinic, and it's open 5 days a week. I'm not sure if everybody understands that when Medicaid expansion allows us to keep those clinics open. It's not just for the patients that are on Medicaid expansion, but it is so expensive anymore, and healthcare is certainly in that area, that if we were to lose Medicaid expansion, we predict we would close roughly half of our clinics, and those two would be top of the list. Those are not money-making clinics. They are slower volume, and so you just don't have, enough patients that roll through the door. And so Medicaid expansion and Medicaid is a payer that helps fund those clinics. And so if Medicaid expansion were to be repealed, not only do you have thousands of people, tens of thousands of people without health insurance, you also no longer have clinics for them to go. And so I don't know where that health care comes from for primary care, for dental, for behavioral health, for medical. And a community like Fairfield, it's not just the Medicaid patients that won't have a clinic in their town anymore. It's everybody won't have a clinic in that town. And I don't know how we bring that back. It would be very difficult for Family Health Services to reinvest, to rehire and restart a clinic if at any given time we feel like a decision might be made to remove the funds. And so it would be a very difficult thing that I do not want to ever have to make. So my hope is through conversations like this, we can express that it's the patients and it's our communities that need Medicaid for everybody to stay healthy, for us to have a healthier Magic Valley.
I guess my job is to talk about what we had before Medicaid expansion and what we will have starting next year, both nationally and in the state of Idaho. Before Medicaid expansion, we had indigent care at the county level and catastrophic care for people that had really serious illnesses. So every county had to provide medical care for the people that were indigent in their communities. And what usually happened is that those people would go to the very most expensive clinic in town, the hospital, the emergency room, where everything is a lot more expensive. And so they would get their care. Sometimes they didn't get to extend it as much as they needed, but they got the care. And then the county ended up with the bill. I can't tell you how many cases I had while I was on the Supreme Court where we were faced with having to force a county to pay a big medical bill because that was what the law said. You have to pay it. I remember we had a case over in Jerome County where we, I think, ended up requiring the county fathers to pay up to $500,000 for somebody's care. That goes on your property tax. Well, people were sick and tired of having those big bills go on their property tax. And so Reclaim Idaho, after years of trying to get Medicaid expansion to cover a lot of people who were kind of in a crack between indigent care and regular medical insurance. And 61% of the people of Idaho voted for it after the legislature turned it down year after year. And you know, by golly, it's been working pretty good since that time. Well, there are people in the legislature who thinks that the thing is too expensive, and by golly, they're going to do away with it. They darn near got a bill through this year to repeal Medicaid expansion. What would have happened? Well, I don't know, but I think that counties would have ended up being the responsible party, because you're not going to let somebody die at the hospital. Or maybe the hospitals would eat it, and you know, that's going to be a death knell for a lot of hospitals in Idaho. So are we going to have a better year next year? Unless we have a change of the players in the legislature, you're going to have the same dance card going on there, and they may get it repealed. Who knows? But I don't think we can take a chance on that. And I'll tell you why. You know, what we do in the state is not in isolation. There is a big cut to Medicaid coming at the national level, almost $1 trillion in what they call this big, beautiful billionaire bill or whatever it was. And anyway, that is going to start biting next year. And it's going to reduce our intake from the federal government over $1 billion, I believe, in the next 5 years. Well, $2 billion in the next 5 years. And, you know, the governor was saying, well, we're going to get $1 billion from this $50 billion deal for rural health care. If you take $1 billion from $2 billion, that leaves $1 billion that we are going to have to either not give medical care to people, or we're going to have to raise it either through the income tax, the property tax, the sales tax, or something. And it just ain't going to work. And then I see the other day that our president says, well, we can't afford child care, we can't afford Medicaid, we can't afford Medicare. We're going to send all that back to the states and they can take up the slack for that. Well, if you can't get $20 million to cover people's severe mental illness, and you have to have 4 people die before the legislature says, well, maybe we ought to give some money back to that program so we won't have a bunch of other people dying, like the sheriffs and law enforcement people predicted would happen. You know, it was a disaster in the legislature this year, and it's going to be a lot worse next year unless we can get people who are more attentive to the needs of the folks and attentive to the fact that a lot of people make not a sufficient amount of money to pay for their medical bills, and they are working their fingers to the bone already. You know, we're going to have a work requirement go into effect next year, and it's probably going to throw about 30,000 people off of Medicaid expansion, if we can still keep that. So what I'm saying is, I think it's going to take a populace that is concerned about the issue, that understands that we're headed for a train wreck, and maybe get some people into the legislature who will respond to that need and give our citizens the help that they need with their medical bills. So.
Well, thank you so much, Jim and Aaron and Steve. Like that was great. I have a couple of things so we're going to jump into, I have some questions, but I actually want to take just a minute and focus in on a couple of things that you both said and reiterate and maybe bring up something that maybe not a lot of people know. So the interesting thing about Medicaid is it's the largest behavioral health payer in Idaho. So for behavioral health services, it is the largest insurance payer for behavioral health services. So I think that's something that's really interesting. I don't think a lot of people know. If you have a child with disabilities or you have a family member with disabilities, Medicaid is the only health insurance option you have to cover the services and therapies that you need that private coverage just doesn't offer. And I also think that's another thing that not a lot of people realize. And then Medicaid expansion, it's there because there was a health coverage gap. So a lot of what I'm trying to get at here is Medicaid truly serves those that are not served by private insurance and would be uninsured otherwise and not have any other option. I also want to just touch to, I know Jim had mentioned the Rural Health Transformation Program, which has been a big topic this legislative session. And one thing I think is really important to note in this forum is that it is time limited to 5 years. It's very restricted in what it can be used for. It cannot provide health insurance if you lose your health insurance. And the legislature gets oversight of it. So just some information I thought you all might like. I'm going to pitch an opening question. Stephen, can you talk a little bit more about who all you typically see on Medicaid expansion and what happens when they don't have health care and we start seeing some of these cuts come down the pipeline?
Great question, and I'll focus this on Medicaid expansion. Medicaid expansion took traditional Medicaid and raised to a higher income the number of people who could then qualify to be on Medicaid. Primarily the people in Medicaid expansion group are working. They tend to work at least one job. Their job doesn't happen to offer health insurance, and they cannot afford health insurance in addition to paying for rent and food and all the things you have to do to just live. So with Medicaid expansion, as Hillary said, we as a state voted strongly in support of it, and we do that today. So a Medicaid expansion patient, they might have hypertension, and now they can come in and take their blood pressure medicine and they don't end up in the ER with a heart attack. They're a person who works a physical job and they break their arm, and whereas before they would go to the emergency department and end up with a $10,000 bill and end up in bankruptcy, now they can go to their urgent care and get a cast and follow up with a primary care physician and not lose their job and not have to go through what bankruptcy puts people through. And so the face of a Medicaid expansion is the face of a family, and it's a face of a group of people who are usually working. And in my experience, my patients who are coming in with that and with Medicaid expansion as insurance, they're both working. It's usually a husband and a wife, and they have kids, and they're both working at least one job, and they just don't have a job where health insurance is offered. What happens if they don't have health care? That's actually, I can say that confidently. Research shows that you're more likely to end up disabled. You're more likely to qualify for regular Medicaid, not Medicaid expansion. And it's because you're one injury away from losing that job. And the average person in Idaho doesn't have much more than a couple weeks of income saved and ready. So, a couple of weeks without work and they're in dire straits.
Thank you so much, Stephen. I think also to add to that, whenever people don't have health insurance, like was mentioned earlier, they go to the emergency room. Well, when people show up at the emergency room, that cost just ends up getting shifted in uncompensated care, which then gets passed on to everybody else in the form of higher healthcare costs. And so I think it's important to know that these things really do impact broader than just those on expansion. Aaron, can you walk through some of the consequences of cutting Medicaid services, particularly mental health services?
Yeah, so Family Health Services, we got awarded the ACT contract from the state. That's the Assertive Community Treatment Program, which is not an easy thing to say. And these folks have a severe mental illness and a psychosis, and so they have to have a specific diagnosis for that. And we've been up and running for about a year, and then in December, the legislation cut the ACT funding. And that's the program that you hear of where the four folks had died. One a month had died since December. We're in Region 5, Family Health Services, and we're the only region that was able to keep our ACT program going. We were able to do that because, well, basically we're diversified. We're not just a behavioral health clinic. We have medical, dental, and so we were taking quite a loss with the hope that that the legislature would put it back. There was some support from some of the legislators, and so if the legislation had not put the money back in, then we would have closed the ACT program. We were the only region that did not have a death from the ACT program. And so when I met with our team and asked them, that we were very excited that the funding came back. Of course, they were very excited because they get to keep their job, and they felt like it made a big difference. And they were convinced absolutely that for sure one, maybe two of our patients would have died had we ended that service. And so it really is life or death to me for our patients who rely on this support. We have success stories. In that 1 year, we had somebody that had been in and out of the hospital, had never held a job, and actually graduated out of the ACT program and holds a job, and now just comes to kind of traditional counseling once a month and is very stable and is on their medication and doing amazing. And that's the goal. And so and that was just a little cut. It wasn't that much money. And they put it back in 4 months after that cut. I don't believe they realized the impact it would have on the lives of those people and those communities. And Medicaid expansion, cutting that, would be 1,000 times worse. It's so many more lives, and it would be so much more devastating than just that. And I don't think they can just roll that back in 4 months if that were to happen. So it is a very, very scary time for folks like us in the healthcare industry when they keep talking about potential Medicaid expansion cuts, because I don't think they realize the full impact, just like they didn't realize the impact with the ACT program.
Thank you, Aaron. So, Jim, the state started the legislative session with a budget deficit. How did we get here, and what are some of the funding mechanisms that help pay for healthcare programs like Medicaid?
Well, I have to tell you about how you deal with a budget deficit. I was elected AG in 1982, and when I walked into the office, we had a budget deficit that was much deeper, I mean, not taking inflation into account, than this one that they have now. You may remember that in the early 80s, if you wanted to buy a house, you had to pay 14.5% interest on your mortgage. The economy was in a crash. Farmers were filing bankruptcy right and left. It was a scary year. And do you know what the government did? Well, Governor Evans, who was governor then, said the Board of Examiners should meet and decide what programs get to be cut. And you know what we did? Pete Centerusa, the Secretary of State, myself, and the governor sat down and listened to every agency, the universities, everybody came in, said what their problems were. We listened to them, and we decided, based on what we heard and how we evaluated it, what we were going to cut. And you had one guy on one party and two of us on another party, and we got it done. You didn't have that happen in the legislature. The minute they got there, they decided they were going to have a cross-the-board cut no matter what. And medical care was one of the top of the issues because it was a big part of the budget. And they didn't really care about how it affected people. And so they slashed everybody. And then, you know, you had to come in and beg, and sometimes they'd listen to you and sometimes they wouldn't. But it was more ideological driven than it was practicality driven. And that's a hell of a way to run a government. And I think, you know, we've got to make sure that people get informed, that they see what happened, that they say, if we're going to get around that stupidity and nonsense, let's put some people into office that will take this seriously and deal with the issue and make sure that those people that can't afford medical care can get it. Because, you know, if you have people that are in long-term care facilities, Medicaid covers 62% of those costs. You're going to have your grandma or your grandpa being thrown out on the street because they can't afford it, you know, or they can't afford the medical care they need to stay healthy, or they can't have people coming in and visiting so that they can stay in their home and get the medical care they need. You know, we're really looking at some serious problems, and I think it's going to take the populace and informed voters to take care of it for us, because I'm not sure that crowd in Boise is going to do it.
Well, thank you so much, Jim. I also want to build a little bit on that. I get questions quite often about, well, how exactly do we pay for Medicaid? It's a part of the budget. How does all that work? And I think a lot of people don't know that Medicaid is actually a state and federal partnership. So the feds pitch in a percentage and the state pitches in the rest. So for Medicaid expansion, for every dollar we put in, the feds pay 9. And it's fixed in statute, so it takes an act of Congress to change that. When you're looking at traditional Medicaid programs, so pregnant women, children, people with disabilities, it's closer to a 70-30 split, and it's really based on how well your economy is doing relative to surrounding states. And so it fluctuates a little bit more every year. I think right now we're sitting at about a 67%, 33% state share. And so that when we're looking at cuts to Medicaid and the legislature's looking at those decisions, those dollars that pay for the state share of Medicaid do come out of our general fund, which is where income taxes and other taxes come into the state. So just thought I'd give you a little tax lesson while we're at it. Thank you guys so much. Those were really great questions and answers, and I think that I hope it gave you guys a lot to think about, because now it is your turn to come up and ask our panel. I love to just, if you have a question, want to provide a comment, even if you don't have a question, you can line up. There's 2 mics on each side. Feel free to get up and just stand there in a line, and I'll give you 2 minutes, and I'll go back and forth between the lines. And so I'd just love to turn it over to anybody who's brave enough to be the first one to stand up and ask a question.
I will stand here awkwardly and look at all of you until somebody comes up.
Thank you, Rich Fontadelli, Idaho citizen, property owner, taxpayer, and I don't mind it. Yeah. These pamphlets that you put out in the back, do they speak about the general politicians' views on Medicare and Medicaid? Each one of them does?
It's a good question, Chanel. Yes.
Yeah, informational.
So it tells us where everybody stands. Okay, talk to me about Governor Lill. Where's he at?
Which one on the panel wants to tackle that?
Does he care for it, or does he want it recalled?
Well, The governor proposed a number of cuts to Medicaid in his budget.
Right?
And the legislature went further on making the cuts than he wanted. He didn't stick with his guns, and he let them do it in some instances. In some instances, he had a line item veto of cuts that they made, but he wasn't very consistent. In my own personal opinion, I think he deferred too much to the budget cutters in the legislature and should have stuck to his guns. So,
Okay, how about Fitzpatrick? Where's he standing? Governor candidate.
he's standing in his saloon in Eagle being mean to everybody he can get. I don't think he's a serious candidate. He's a laughingstock up in Ada County. He's got all kinds of crazy ideas, and you know, I don't think he's kind of on the Amon Bundy bandwagon. So that's my view on him.
And lastly here, balanced budgets are important. We all understand that we can't live owing people money. The federal government has a right to cut some of our state funding. We're all IRS supporters too. But are we going to be able to afford locally in Idaho Medicaid if we get the substantial federal cut?
Well,
That one yours?
I'll take a stab at it. And it's a good point. The federal government, I'm talking about Medicaid expansion now, and correct me if I'm wrong, the federal government pays about 90 cents on the dollar, and the state of Idaho puts in 10. The legislature will be required to address it if the federal government cuts that number down. And I couldn't tell you today what the state of Idaho would choose to do. But yes, if the federal government does choose to cut that 90% to something else, our legislature is required to actually take that up and address it, as opposed to maybe not. I'm forgetting the wording of the rule or the law, but I know that our legislature would take that up if there was a change, even by 1%. So I think the state of Idaho fiscally is responsible, and they do a good job of balancing their budget. We could have a discussion about tax cuts and maybe too much, but it's really, I think the discussion here today is around Medicaid and helping people, where as much as possible and as efficiently as possible, get access to health care so they can stay healthy.
And I think I'm happy to build on that a little bit too. I think that Idaho can't afford to lose Medicaid expansion, I would argue. Because when you cut 90,000 people out of healthcare, if for some reason the federal government, which I will say will take an act of Congress to change that match rate. And I think if you look at the makeup of Congress, there are a lot of congressmen in there who are hesitant to drop that 90-10 match for their particular state. So I truly don't anticipate seeing any of that happen anytime soon, but that's just my own viewpoint. I think that, and yes, there is a law that if Medicaid expansion funding dropped below the 90% federal match, the legislature has to review it and decide whether or not to keep it. I will say we have very healthy stabilization funds and reserves, and Idaho doesn't have a revenue. There's opportunities for revenue raising to address things that are important to Idahoans and to the Idaho legislators. I think that if you look on the other end of if they decided to cut out Medicaid expansion or seriously cut down Medicaid, we start running into the problems we're talking about today. A lot of people become uninsured. You're going to see hospitals close. You're going to see clinics close. And I think that it's something that it would be financially devastating for Idaho in a lot of other ways. So I guess my argument would say that I don't think Idaho could afford to get rid of expansion.
Maybe one more, I'll be out of here.
If anybody wants to come up and stand in line and get ready for the next question, that would be great.
Autistic children. They're somewhat currently by the Medicaid program from Idaho, is that going to stand a substantial cut if the budget has to wax them somewhere?
So I don't think directly what you see is, I think those children would stay on Medicaid. I don't think that's the issue. I think the issue becomes then the number of providers that are available to take care of those kids and the primary care providers that'll be able to see them. We've already seen huge cuts through Healthy Connections that really affected a lot of pediatricians pretty substantially. I know some of them had to decide, am I going to stay in Idaho or am I going to move? Am I going to establish a practice in another state where, it's more financially stable than in Idaho? So I think that it's easy to say, oh, yep, a child with autism will retain Medicaid, but having access to services because of other cuts is where the real dilemma comes.
Thank you. All right.
Thank you.
Yeah, thank you so much for the question.
So I have a couple questions. But the first one is one of the criticisms I hear a lot about Medicaid is that there's a lot of waste, or there's people receiving Medicaid who shouldn't be. And I would like to hear from you guys if that's been if you see this a lot, if this is something that exists.
I think the Department of Health and Welfare has looked at it and determined, just recently that there was not a lot of Medicaid fraud or Medicaid misuse. The people that get it are generally people that are working. They're just not working at jobs where they can make enough to pay for their medical bills. So I don't think we've got a problem. There may be in other states, but I don't think there is one in Idaho.
Okay.
And I'd like to actually add on that too, because the One Big Beautiful Bill Act, quote unquote, that passed last year, there were a lot of provisions in there to try to shore up some of those fraud and waste prevention efforts. So some of it was things like checking over master death records and making sure that people who have passed away, they're not actually still getting billed for Medicaid. Checking to see make sure people aren't enrolled dually in different states. So there were several provisions that were put in place to help with some of those efforts. There's actually some national reports that they put out annually from the federal level as well as the state level that actually does the fraud, shows what the percentage of fraud actually is in the program. And when you look at the actual cases for individual fraud, it's like 0.001% of fraud from individuals. It's very, very rare. The majority of fraud or waste or abuse that happens is usually large corporations, large medical providers that have billing errors, or they accidentally bill wrong, or things like that. So most of I would say a lot of the fraud happens in larger contexts of bigger companies. And then also too, another thing I think that you could compare it to is, I would say there's probably about the same amount as you would see in Medicare or private health insurance. There's always going to be a level of fraud across all health insurance programs, and Medicaid's not immune to it, unfortunately. But I think the narrative that it's full of this fraud, waste, and abuse, I think is just largely out of fear that dollars aren't being spent on where they need to be spent. And the data just doesn't really support it.
Okay, thank you. So, and my next question is kind of to Dr. Coates, and that is, so I've read where some of the with Medicaid funding, if it's cut, one of the ways is we'll just reduce how much a healthcare provider is reimbursed for their services. And I was just curious of from you the impact that would have on your practice and other doctors' practices.
Yeah. Most practices accept Medicaid because they're part of a nonprofit or they're a community health center. Private practices that accept Medicaid, they do so at a loss. So generally speaking, Medicaid reimburses at a level that's below what the daily operating costs, what break even is. If they saw all Medicaid patients all that day, they would actually lose money that day. What you see practices having done, especially with this cut that's now sustained, they're just either never accepted Medicaid in the first place. If pediatricians, this hits them right in between the eyes because such a high percentage of pediatric patients are on Medicaid. They have to consider whether or not this is the right place for them. And you'll see a lot of primary care practices. They just can't bring themselves to kick their Medicaid patients out of their practice. They love these people. They've been taking care of them for years, so they'll continue that relationship, but they're not going to accept anymore.
Thank you so much for great questions.
There is one thing I'd like to add there. Idaho has the lowest ratio of doctors and nurses in the nation. And we've determined that we need to have 1,400 additional medical professionals to take care of the need. You cut Medicaid, and that cuts right into the doctor's reimbursement, and you'll see even fewer doctors and nurses as a result.
I mean, I get to add my 2 cents, right? So, we recruit physicians, and rural Idaho, we have the ability to recruit physicians that also do OB. So all of our physicians deliver babies in the hospital. And we're pretty proud of that. That's not the case in most bigger cities and lots of other states. And so, not everybody wants to go and be a doctor, do all those things, go into family practice, and then wake up at 2 o'clock in the morning and go deliver a baby and live in Buell, Idaho, right? There just aren't that many. We used to do a great job of recruiting physicians because it was really inexpensive to live in Idaho and buy a house. And after COVID, I think everyone knows, not so much. Still one of the fastest growing states. Cost of real estate, cost of living has certainly increased. And so we don't have that competitive edge. And we, as a community health center, we do not pay our providers nearly enough already. Almost everybody that we hire as a dentist or a physician grew up in Idaho, wants to come back to Idaho and practice. But at some point, the dollars from other states is just too much for them to make that decision for their family. So that would be another loss of being able to hire and retain and recruit physicians if they removed expanded Medicaid. I don't know how we struggle competing now. It would get even worse.
Thank you so much.
I guess continuing on that line, the loss of physicians in the state of Idaho isn't part of that because of the strong bill that we have that not allowing women to make choices and charging doctors and putting them in prison if they make choices that could be considered an abortion.
Thank you.
Yeah, I don't want to step into too deep on this one. The short story, there was a published study of what happened in Idaho after Roe v. Wade was overturned, and the objective outcome is we lost 35% of our OB providers, so a third of people delivering left, and that includes that number included both the people who left and people who had been hired. So it wasn't just picking and choosing. It said the number of people who did it went from here to here, and so objectively, doctors have spoken with their feet.
Right. Okay, thank you. I appreciate that. And then my understanding is also that some pediatricians are not practicing because of some of the strict transgender laws, that they can't actually counsel children, they can't help in ways that they wanted to. Can you address that?
So this would be in the scope of practice of pediatric endocrinologists. As you might imagine, not a lot of them across the whole country. I couldn't speak to the pediatric endocrinologists in Idaho, like what happened to ours with the passage of the laws. But certainly that would be what would have been part of their scope of service, but isn't now since it's outlawed.
Okay. And I also understand that we aren't even getting interns and residents to come to Idaho because of some of these same issues.
Yeah, I'm not aware of any objective evidence I can point to and say this person is a great candidate but choosing not to come here. But there's lots of reasons people might choose or not choose a residency in Idaho. And you know, I would hypothesize that perhaps that's one of them, but I don't have anything I can point to say this is evidence to say this is changing people's decisions.
Yeah, it was something that I heard on the radio where a gentleman who brings in interns and residents said that they were having difficulty because people didn't want to come because of those reasons. Also, so my other questions, did anyone try to get rid of the voucher program since we had this deficit and over 30,000 people called into the governor, said we didn't want the voucher program? Was that even brought up in this legislature, the last legislature, to get rid of that? There's $50 million right there that we could have used for health care.
I had suggested that that should be done, but nobody took up the suggestion in the legislature. They did, however, pass legislation to allow children at private and parochial schools to go to athletic programs at the public schools.
Okay.
So, kind of the reverse.
Yes. Okay, just one more thing. So how much is it going to cost us, or does it cost anything, that Governor Little is now inviting the Turning Point people to bring in the Club America to all the high schools in the state of Idaho?
I don't know if any of us would be able to really comment on that. I think that's a good question for his staff and for other legislators and
Okay.
candidates.
Well, thank you for answering my questions.
Thank you.
I have a question. So there's been a lot of talk about a rainy day fund. Can anyone open our eyes to that? Is there actually a rainy day fund in the state of Idaho? And why aren't we looking at that to help us?
I just actually happened to write an article quoting Senator Jim Guthrie, who I think is really a fine individual. He's from McCammon. And Guthrie said, you know, we're cutting all these budgets and we've got a $1.7 billion checking account in our rainy day fund. Why aren't we looking at that? Why aren't we looking at cutting legislators' salaries? Why don't we use a little common sense? And that drew an opponent who's running against him on kind of a Christian nationalist bandwagon. And he was just endorsed by our Attorney General. But I won't say any more about that.
I think you summed it up pretty well. I would say this was a really big debate this legislative session. We saw many legislators push for that and push back against the cuts and want to use some of these stabilization funds. So I encourage you, as you talk with candidates, ask where they were at on the issue, because I don't even think many of them had the opportunity to even vote on whether or not to use those funds.
You know, I can add a little bit. I'm not going to say anything about who anybody should vote for, but I'm with an organization called Take Back Idaho, and we have done a very careful job of making nonpartisan analysis of people's voting records and what they say they're wanting to do. So you can go online, Google Take Back Idaho, and we should have our voter guide out in the next day or two. So check it out, and it will show you who is on which side of which issues. I think it'll be helpful.
Is it both parties?
Yes, it's both parties, and I think independents too.
Probably
time for one or two more questions. Anybody want to shoot for the last question? All right, you gotta take it.
So I run a behavioral health organization, and I've spent a lot of time with our legislators, both Senate and Republican, and I find that if they're new, it takes them a year or two to understand what the budget looks like. And I'd really like to know, Mr. Jones, what do you feel like we as citizens can do to help educate? Because what I see is, you made the comment that you just sit everybody down and you listen to everything and then you whack this and you keep that, and it's really simple. Except for, how do we help our world decide, is education for that child more important than healthcare for the child? Is the arts and learning to read more important? So I'd like you to expand, if you could, or anyone else, on how we educate legislators and how we make it a little bit simpler, if it's possible.
You know, my view, and you know, I watched this game for quite some time. I did a lot of legislative work back in the 80s. Back then, if you went to a committee, you know, they'd let everybody speak and they'd listen and take in what they heard. Doesn't happen very much in this day and age. In fact, there have been so many times people have said, I tried to get something said, I tried to get a chance to offer testimony, and nobody would let me do it. I think your best bet is to work with your individual legislators, like for Magic Valley here. You know, try to get in individually to see them, or maybe if they're out in the community, try to pin them down. Because if you can have that person-to-person conversation, it makes an impact. And I know that there was a guy who, up in Ada County, who changed his vote on the education tax credit and voted against it when he got some one-on-one input from somebody that would have been affected. If you're out of the district, people are probably not going to listen to you. But if the person you're talking to is the one that is in your district and they're going to count on your vote, they'll often do it. But I would try to get it done outside of the State House, where they're actually maybe inclined to listen. Like at the State Fair, or I mean the Twin Falls County Fair. You know, if you can buttonhole them for just a few minutes and say, this is what I do for a living, and this is how it's affecting me and all of the people that I work with. Because if they can get that one-on-one contact, sometimes that works wonders.
Thanks, Jim. All right, we'll take one more question. Yes.
Thank you for that, and thank you for being here. I'm also a behavioral health agency owner here for the last 26 years, and I'm really worried about our Magic Valley specifically. And so I've been spending tirelessly hours trying to educate our local Magic Valley legislators, and I'm telling you, they're not listening. They don't care. I appreciate your time and all that you've done. They're not listening. So we're in a crisis in the Magic Valley, and if we don't get active, we are going to lose people, more people. So I try to educate them and say the programs that are run by Medicaid are not soft on crime. They are life-saving, they're life-changing, effective, because they save money in the long run. So anyway, I can help there.
Thank you.
Well, as I recall looking at the candidate list, there are a full slate of candidates in the Magic Valley.
Yay. All right. Thank you so much for the great questions. Thank you so much for our panelists. You guys have been great. now, for a really fun part of our program tonight, I am going to invite Chanel Dixon, the founder of Idaho Solutions, up to the stage.
Woo! Well, thank you. Thank you for everyone for being here tonight, and thank you to Hillary for moderating and for our panel. As you know, as was intimated in the last comment, the majority of our elections are going to be decided during the May 19th primary, the Republican primary. And just to put a little plug, early voting starts at County West on April 27th in Twin Falls County. So tonight we invited all of the candidates on the District 24 and District 25 Republican primary ballot to speak on the different healthcare issues that we have discussed tonight. There are no contested races in either of those districts in other parties, and so we only invited people who were in the contested races. As another reminder about voting, only Republicans and then unaffiliated voters willing to request a Republican ballot can vote in the Republican primary. But tonight we're going to, as we kind of wrap up, I'm going to invite the candidates who have come tonight for these different seats. And so I don't want to miss anyone, so you can raise your hand if you're here and I miss you. Let's go ahead and we'll start with Alexandra Caval. And I am going to ask each of them, they'll have 2 minutes to kind of explain their position on some of the things that they've heard tonight. The specific question for each of you is, where do you stand on the healthcare issues we've discussed, including Medicaid expansion, and do you specifically support repealing or protecting these programs? So, Alexandra, let's have you come up first. We'll have you come up here, yeah, so everybody can see each of you.
Thank you for coming out, everyone, tonight. My name is Alexandra Caval, and I'm running for House Seat 24A, which is rural Twin Falls County, Gooding County, and Camas County. And Chanel, to answer the question that you asked, this is a topic that has come up at many doors that I have knocked across the district. I think Medicaid expansion, which has been the hot topic tonight, it's something that 57.7% of the voters in District 24 approved back in 2018. And my personal position or thoughts on it are, if your district has voted for something, it is not your job, the legislator, to get to the State House and undo or vote against what your constituents have voted for. So would I support it? Yes. Would I ever try to repeal it? No. The only ones who should vote to repeal it are the voters who created it. If the voters of the state of Idaho voted to repeal it, then at that point I would support it. But I think legislators should vote with their district. I also think so in my day job, I am a bankruptcy lawyer, which I deal with finances. And one of the things that I see, Mr. Coates, across the country, because I do get briefings about what happens nationally, our healthcare system. You see hospitals starting to fail and trying to reorganize across the United States. It's only going to be a matter of time until something like that comes to Idaho. That's something we really should avoid, especially in a rural district where we don't have that many hospitals. I think, as a bankruptcy attorney, that Medicaid expansion is the best use of taxpayer dollars. I know and worked in the system when we had the indigency fund, the CAT fund, and that puts too much of a burden on local property tax owners. So you as voters get the best bang for your buck when you get to tap into federal dollars to share that burden of that healthcare cost. So those are my thoughts on the issues. I'd love your vote on May 19th. Thank you.
All right, let's see. Chance Requa, we'll have you come next since you're also a candidate in District 24. And just to repeat, I'll repeat the question for all of you guys. Where do you stand on the healthcare issues we've discussed, including Medicaid expansion, and do you support repealing these programs or protecting them? We'll give you 2 minutes.
Okay. I just want to thank everyone else again for coming out tonight. Thanks for our speakers. A real joy for me to continue to get to learn. I'm a 6th generation Idaho farmer. I'm born and raised here, and I'm also a coach. And so as a coach and somebody who works in the school district, and I work at Canyon Ridge High School, I get to see a lot of our disadvantaged students who come in who live their life in challenging homes and in homes that are have less opportunities. And I know a lot of students, my athletes, who get the opportunity to be on Medicaid, and their families that have to deal with that. And as an Idaho farmer, when we talk about these issues, I grew up really fortunate to be healthy and to be happy and to live a great life, and I'm fortunate for that. But I also get the opportunity to experience in my personal life a lot of mental health issues. When I talk about my pillars and what I want to run for, it's easy, and I would agree with Alex when we talk about what our constituents want. 57% of people voted for Medicaid expansion. Recent polls have shown that that number is up to 73% of people who want to maintain Medicaid expansion. In my own life, my sweet fiance is currently dealing with a mental health issue, and to see the wait time that she has had to go through for a provider, before I get emotional about it, it means something to me. And I know that it means something to our Idahoans, to our people in our districts. Mental health is health. Health is health. It is important. And as somebody who wants to go and represent District 24, our rural districts, our wonderful hospitals that we have here, our like Northside Canyon that I got the opportunity to go see, those places matter to our voters. Those places matter to our communities. And if we underserve them, we continue to underserve Idaho. And that's not what makes Idaho great. And as somebody who believes in the Magic Valley and who believes in Idaho, I believe that those things, that Medicaid expansion, that our healthcare providers, what they provide to our people, those things are what make Idaho great. And so as somebody who looks for your vote on May 19th, I just want to say that it's an area that's near and dear to my heart, and something that I look forward to continuing to pursue and to push as we make sure that Idahoans and people in District 24 continue to have coverage and continue to be living in a place that understands their needs and understands how to serve them. And I think that this is an issue that requires a lot of real attention and deep concern. So thank you guys so much for having me tonight. I look forward to having any questions that you guys have. I know the other candidates do as well, but please feel free to ask, and thank you again for tonight.
All right, now we'll move on to District 25. Sherry Vollmer, we'll invite you up, and while you're walking up, I'll remind you of the question. Where do you stand on the healthcare issues we've discussed tonight, including Medicaid expansion, and do you support repealing or protecting these programs?
All right. Hello, I am Sherry Vollmer for District 25, which is primarily Twin Falls and a little bit west of the county, in the county of Twin Falls. And Medicaid expansion is just extremely important. I think an echo from what you've heard, it is so vital for our community. It's vital for our rural communities. Hearing about Fairfield and just thinking of where those people would go if that clinic was shut down. I mean, all of the doctors there weren't there. How far would they have to go? And I look at our community here, and Medicaid expansion, I mean, just on a basic note, it just makes our community healthier. So when you're going to the grocery store, or you're going to the mall, or you're going somewhere, you're around healthy people because they're able to access health care. And that is so vital for our area. I have a really hard time thinking that that's such a hard issue for some of the legislatures up there. But you can be sure that is one thing that I would listen to, and that I definitely have the conversations. Aaron and I have talked before, Stephen and I have talked before, and I love your articles. You write one or two a year, and they're very good. But really, talking to the local people and talking to the different doctors in the area, and really understanding what that means to us, and not just on a surface level, really understanding how that affects our community and affects our hospitals and our healthcare. So this is a really important program to have. So as my two neighboring district colleagues had mentioned, May 19th is a very important day. Early voting is April 27th. I happen to really love early voting. So anyhow, we just would really love you to do your research and really make a point to come out and vote, because it really does matter. We have less than a third of the people that come out and vote for the primaries, if we're even lucky to get a third of the percent, actually. And that's not representative of our community. So we really have to make an effort to get out there, each and every one of us, to get out and vote and exercise your voice, please. Thank you.
Okay, Casey Swenson, also with District 25, and I'll remind you of the question as well. Where do you stand on the healthcare issues we've discussed tonight, including Medicaid expansion, and do you support repealing or protecting?
Hi, I'm Casey Swenson, running in District 25. I previously worked as a prosecutor. When I was doing that, we were on the indigent fund. So I saw up close and personally how bad that was for county budgets, and how that directly impacted the property taxes to cover those indigent funds. I can't remember if one of our cases made it up to you or not, but I do remember there was one for about $100,000 that was we were having difficulty resolving. So maybe we did have one make it up there. So I saw that firsthand of how important it was to fix that program for the state and for our taxpayers, and that's what the expansion did, and so I do support the expansion. Also, in District 25, it was overwhelmingly supported by the ballot initiative, which is as direct of democracy as we can get, and so I would continue to support what our citizens in District 25 want. But that fund is huge, and I saw the impact of not having it and then having it, and what that did to our counties, our taxes, and the impact community. From a nuts and bolts standpoint, getting rid of something like that or not having it, there was one experience I had in that where a lady had disassociated, and she was having a break. She'd put 5 cats in a backpack, which I'm not sure how you get 5 cats in a backpack, and she was trying to walk to Boise from Emmett. And so obviously someone had stopped, the police got involved, and realized that she had disassociated, was having a break. She was in and out of homelessness, so she was offered medication. The resources that takes for the police, if it just stops there and we don't have mental health support, where do they go from her there? Do they just send her on her way until she dies on the roadside because they're not going to arrest her? If they can't come in and have the resources for the 72-hour hold to get an effective evaluation, so they just have to release her. What's the impact on the community at that point? She has no treatment. If they're there for up to 68 hours because there isn't the adequate funding to get the evaluation, that's law enforcement sitting in the emergency room instead of out patrolling our streets to keep us safe. And then if we don't have access to treatment, if she can't go in, get her lithium treatments going again, get back to baseline, and then hopefully get resources out in the community, then she is just going to be in and out of that system. So even if you don't care about that person for some reason, the nuts and bolts of it are a huge cost to our society financially and resource-wise in keeping ourselves safe. I hope you do care about that person and her 5 cats and would want to support the programs that can give her a chance to go live normally among us and help her out. So that's why I do support it, and I think it's a good thing from the nuts and bolts standpoint and also from the human standpoint. Thank you.
obviously a little shorter than Casey. All right, well, thank you so much for each of them. And there were a couple other candidates earlier, but I think they must have left. Okay, I'm not missing anyone. All right, well, we appreciate our candidates who came tonight. We appreciate our panel and Hillary, our moderator. We thank all of you for coming. Before we close out the night, we're going to give our panelists each 1 minute to kind of give a closing thought or statement, and then I have just one other thing to say. So we'll let you pick and choose.
Thank you. Look real quick. On the bottom. Thank you. I don't know. Oh, there it goes. Okay. Yeah, I just want to say, reiterate, democracy only works when people are well informed and vote. Please, please, please vote in the primary.
I grew up in Idaho, graduated from Jerome High School. My kids, hopefully, going to graduate from Jerome High School. I love our conservative values, and it just needs to be reasonable conservative values. I just really appreciate everyone that came out tonight to support and realize how important this is for our community. So I just want to say thank you.
I have a word of caution based on an experience I had after I had lost an election in 1990 for the Senate. I was up at the Morrison Center watching a program, and they had an intermission. And I see these three old veterans sitting over here talking amongst each other, and they waved me over and they said, "Jim, I think you've got a really good chance of winning." I said, "Well, thanks, guys." I didn't inform them that the election had occurred a month earlier. Sorry, guys, you're a little too late. Don't be late.
Well, thank you. That is good advice.